to our next presenter, and Dr. Jennifer Ty is coming to us as a orthopedic surgeon from a couple of hospitals in New Jersey, I believe, is where the Nemo's Alfred I. DuPont Hospital and Christina hospitals are. You'll have to correct me if I'm in error, Jennifer. Jennifer has been so helpful in helping us understand that syndactyly in the TS1 children is quite different from what they see in normal syndactyly. And Jennifer, we're so appreciative of you helping us with this report, and I'll turn the time over to you.
Thank you so much, Catherine, for that kind introduction. I'm actually at Nemours in Wilmington, Delaware. For those of you who are international, it's a very small state, but it's located right next to Pennsylvania, which has gotten a lot of press lately. So just to kind of, but thank you, Catherine. It's actually been a pleasure to work with you on this project, and I very much appreciate this opportunity to share the information that we've gathered. I also want to, of course, acknowledge Douglas Hutchinson, who's a pediatric hand surgeon in Salt Lake, in the Salt Lake Shriners Hospital system for his contributions. And I want to thank the leadership of the Timothy Syndrome Alliance for this opportunity to speak with you folks. Obviously, I think a lot of you are far more knowledgeable about Timothy syndrome than I am. But as you know, it's a missense mutation in exon 8A of the CACNA1C gene, and it's associated with a long QT syndrome. And Timothy syndrome type 1 does also tend to have syndactyly or webbing of the fingers and the toes. It has been associated with other conditions such as congenital or structural cardiac abnormalities, developmental delays, and autism, some mild facial differences. And as these children are growing up, we're learning much more about some of the multi-organ system health concerns as been shared with some of the other presenters today. So Timothy syndrome can present a diagnostic challenge. As you are all well aware, it's a very rare condition. So most clinicians may not necessarily know that much about the condition or have many patients with Timothy syndrome. There are some facial differences which are described, but they're very subtle. And this is oftentimes, although it is autosomal dominant, oftentimes the child may be the only patient who has the condition because it's frequently a de novo or a new mutation in the germline. There are some cases of parental mosaicism where it's only present perhaps in some of the cells of a parent who's otherwise not symptomatic or doesn't exhibit the syndrome. And again, it's a very rare condition. Syndactyly may be one of the most obvious differences at birth. Syndactyly, in contrast, is actually relatively common. About 1 in 2,500 live births may have syndactyly. And what it is a failure of programmed cell death or apoptosis. So everyone actually starts off forming their fingers as webbed, but then the area between the fingers actually undergoes apoptosis and the fingers separate. And patients who have Timothy syndrome may not be diagnosed with Timothy syndrome prior to their syndactyly surgery. And syndactyly surgery usually occurs somewhere between 1 year of life and 3 years of life, so when the children are still very young. Now, this can be a problem because anesthesia has a particular risk with patients with long QT syndrome, in that anesthesia can precipitate cardiac arrhythmias. This is due to a variety of different factors. There's a lot of physiologic stress, which is associated with anesthesia and surgery. There's emotional stress, which is associated with anesthesia and surgery. And the stress hormones can precipitate some of these cardiac arrhythmias. In addition, there can be electrolyte abnormalities or hypoglycemia due to some of the recommended fasting that we generally recommend prior to surgery. There can be a sympathetic response, so simply having a tourniquet, and a tourniquet is used to control the amount of bleeding during surgery, and simply having a tourniquet on your arm can also, the pain response to the blood vessels can create some of these factors which might create cardiac arrhythmia. And even the anesthetic agents themselves. So there are many medications which may prolong the QT interval and precipitate arrhythmias and other problems. So anesthesia poses a particular risk for patients who have long QT syndromes. So when Timothy syndrome began to be more widely known and was described by Catherine Timothy and her co-authors, people became aware that there is this condition where you can have syndactyly and this long QT syndrome, and that places patients and children at risk during surgery. So some institutions said, well, to be safe, we really should screen all kids who have syndactyly prior to syndactyly surgery. So we can try to pick up some of these patients who may have this undiagnosed syndrome, which may precipitate them to particular risks during surgery. Okay. And so some institutions began screening all children. However, they found that this wasn't without its own issues. So again, Timothy syndrome is very rare, but syndactyly is very common. So somewhere around 1 in 1,200 live births has syndactyly, which leads to around about 3,000 infants in the United States may be born with syndactyly every year. So Boston Children's presented their information where they did in fact adopt a universal screening protocol where all patients who are undergoing syndactyly surgery were screened. And they found that no patients were diagnosed with Timothy syndrome, but they had a relatively high false positive rate. 10 patients had EKG abnormalities, but upon additional evaluation were found to be normal. And although the screening costs of the EKG were relatively low, there were testing costs and parental time costs, and also parent and patient anxiety over having to undergo some of this additional screening. So they found that there was insufficient evidence to support routine screening in all patients. However, I belong to a group of pediatric hand surgeons where really it's a group that really focuses on the care of children with hand and upper extremity conditions. And we began to talk amongst ourselves because, again, Timothy syndrome is a very rare condition. Each of us may only encounter 1 or maybe 2 patients in our career who has this condition. And we found that these patients with Timothy syndrome didn't seem to have quote unquote normal syndactyly. They had these what we would consider to be relatively unusual or different syndactyly patterns. And so we began to talk about, well, maybe we shouldn't be screening all patients with syndactyly, but perhaps we can identify specific patterns in syndactyly which would benefit from additional cardiac screening to diagnose patients with Timothy syndrome. And so, Doug Hutchinson put me in touch with Catherine Timothy, who has had a long database of patients, both patients used in the original investigation of Timothy syndrome, as well as additional patients from both published case reports and referrals. And we reviewed the data on these groups of patients. So we found 45 patients with clinically diagnosed Timothy syndrome. About 37 of them were genotype positive. So again, some of these patients were prior to the perhaps finding the gene of Timothy syndrome. So they were not all genotyped. And of these, 42 patients had a well-described what kind of pattern of syndactyly they had with their hands. 26 of these were male and 16 were female, so slight male dominance. And most of these patients were bilateral. So 37 patients had bilateral syndactyly, only 5 had unilateral syndactyly. And so this is what we found. On the right is historical data. So the data that has been sort of widely regarded in terms of what typical patterns of syndactyly. And you have the thumb, the index, the middle, the ring, and the pinky finger. And predominantly, the most common by far is middle and ring finger syndactyly. So almost 60% of patients with a syndactyly who do not have Timothy syndrome will have a middle and ring finger syndactyly. A smaller group will have a ring and pinky finger syndactyly. And of these, about half of them will have bilateral syndactyly versus just having one hand with syndactyly. Now, what do we find in patients with Timothy syndrome? So we found that the 43% of patients actually had a syndactyly involving both hands of the middle, ring, and pinky finger. A slightly smaller percentage had bilateral syndactyly, so syndactyly involving both hands, involving the index, middle, ring, and pinky finger. And smaller groups had other patterns. So the next largest groups were a left hand only involving the ring and pinky finger, and both hands involving the middle and ring finger. We then looked at, well, did they have associated toe syndactyly and what kinds of patterns did they have with their toes? So of the patients where we had described finger syndactyly, we found that 29 of these patients also had information about whether they had syndactyly of their toes and what kind of syndactyly of their toes they had. And of these, 27 or 93% have toe syndactyly. And 21 or 72% had bilateral toe syndactyly involving the second and third toes. So toe syndactyly was very common in patients with Timothy syndrome, and having toes 2 and 3 was relatively common. So there's always limitations with any studies. The limitations of this particular study was it was a retrospective case series with had multiple sources. Not all the patients were genotype positive, although they all clinically had Timothy syndrome, and that we didn't have complete information with regards to maybe some more of the fine details and specifics as to what kind of syndactyly the patients had. We really knew what kind of fingers were involved, but maybe did the syndactyly go out to all the way to the fingertips and involve the nails, or was it mostly a soft tissue syndactyly, which maybe didn't go all the way out to the fingertips? So our conclusions was that a bilateral middle ring and pinky finger was the most common syndactyly pattern. At least close to 70% had at least one hand with either a middle ring and pinky finger or index, middle ring, and pinky finger syndactyly. 90% had syndactyly that involved the pinky finger. 93% not only had syndactyly of the fingers, but syndactyly of the toes. And we really feel that this supports recommendations to screen these patterns which are atypical, which are not common syndactyly patterns for Timothy syndrome with EKGs prior to syndactyly surgery. And Catherine Timothy and Doug Hutchinson and I are working to get this published so that particularly other hand surgeons and orthopedic surgeons and plastic surgeons are more aware of the need to screen these patients' populations in the hopes of diagnosing patients with Timothy syndrome prior to anesthesia. So I want to thank again my co-authors, as well as members of my that I work with at DuPont Hospital. And thank you all for this opportunity to speak with you. I do want to thank all my patients. I know at least one of my patients said that they might be, the family might be logging on today because they really are the people who are driving a lot of this work. So thank you very much.
Thank you so much. We do have just a few minutes. If anybody does have any questions, I do actually have a question, mainly because I'm a mosaic, and so I was born with a partially web. What are you finding? Are you finding any parents like me?
So again, it's a really rare condition. I've only had the great fortune of working with one family. My understanding is that they, you know, they don't have the mosaicism condition, and so I don't have much experience with that.
That's fine. Thank you.